So I'm just about to get my COVID vaccine, the first shot of the two that are required from Moderna. I'm here at St. Peter's Medical Center, which is my employer, and I'm excited that this is the first step, I believe, in getting all of us back to some sort of normal life that we're used to, and I'm thrilled that this is a breakthrough in science, that we're actually able to get to this point so early, since this vaccine was just came out in a record-breaking amount of time. I believe that this is truly a miracle of science and our best hope for eradicating this scourge that we've dealt with for the last year. I'm looking forward to getting my shot. I'm looking forward to 2021, and I'm looking forward to all of us getting back to some normal life that we were used to pre-pandemic.
Any questions, any concerns?
No, I think I've read more about this than I have ever read about a vaccine
In your life?
in my life.
Okay. Are you left-handed or right-handed?
Left-handed.
All right, so you want me to give it in your right arm?
Yeah.
Okay. So I'm going to ask you to turn your chair this way. You got to take a picture of that.
She was great.
Okay. Good job. Now we're going to give you a Band-Aid there. And
Does it have an EB signature on it? No, I'm just joking.
okay, you're all set.
Thank you. So just about a month ago, I had somebody come into my medical office, and 50 years old, perfectly good health, great shape, no underlying medical problems. She was a dancer. In fact, she ran her own dance studio. She got COVID back in June. And ever since that, she was in my office somewhere around October. She still hadn't really recouped in terms of her lung capacity. In fact, our tiny little office room, she probably couldn't walk across it without being short of breath, even difficult to finish a sentence. The problem is that you can't always predict who's going to get sick from COVID. We know that there's certain risk groups that are greater: the elderly, the people who have chronic underlying medical conditions, morbidly obese people. That's true. But that's not 100%. And the patient that I had in my office is a prime example of why you just can't let your guard down with COVID. But we are at a crossroads right now. We're here at a point in time where we really can beat this, but it requires vaccination. And I know that there's many people out there that are very concerned over the safety of the vaccination, that it was rushed through, that there wasn't enough studies done, that we don't know what the long-term effects are going to be. And I don't want to not validate your concerns, but you should understand that the process that the pharmaceutical companies went through in order to get these vaccines out were no different for this one than any other vaccine. The approximately same number of people were tested, approximately the same amount of information was known after those studies as was for other vaccines. And the reality is that each person needs to make their own decision. For me, it was really obvious because as a physician, I'm constantly in contact with patients. And anybody like myself who's in the public eye all the time, interacting with people on a regular basis, the risk of getting COVID exists all the time. So we need to rely on what we have now. And for me, the information that we don't know about the vaccine is so much less than what we do know about the horrible effects that could occur if any one of us were to potentially get COVID. Yes, most people will do well. That's true, but you don't know which ones. So for me, it was really not a difficult decision at all to move and have the vaccine done, which I'm very happy that I did. Reality is not really going to work for getting us back to normalcy unless the vast majority of people in this country take the vaccine. Estimates are that you have to be at approximately 70% in order to get some sort of herd immunity so that the rest of us can feel safe, even those that didn't take the vaccine. And since kids aren't being treated right now, since studies haven't really proved that you can use them safely in children yet, that means that among adults, we're going to need to be above 70%. So for those who are really worried most about side effects and that it hasn't been tested for a long time, For those who are sort of in that group 2 or 3, not getting the first rounds of vaccines, you're not going to have to worry about 40,000 people tested. By the time they get to you, millions of people will have been treated with the vaccine, and we'll know vastly more information about the vaccine than we know even today. So I encourage you, strongly encourage you, to consider getting vaccination when it's your turn, because that's really the safest, quickest route to return the entire country, the entire world, back to some level of normalcy that we've been missing for the last year. Thank you.